Hi, I'm Sondra Ford with Trusted Senior Specialist, and welcome to our live presentation about the annual election period. There's a lot of questions or a lot of commercials and a lot of mail, and it's all talking about three letters, AEP. So what does that really mean, and does it apply to you? So AEP stands for the annual election period. If you recall, when you were in your workplace, you probably had like a special month where they had their open enrollment, typically in October or November, where you can make changes to your group health plan. It's the same thing, but it's specific to Medicare. So if you're a Medicare beneficiary, whether you are approaching your eligibility or you are an experienced Medicare beneficiary, then this is important that you understand what AEP really means. So annual election period. Every year, Medicare allows us to look at our plans and compare them. Now, I'm not talking about people who are on original Medicare and don't have any other benefits, but if that is you, I do encourage you to learn about plan options, and whether that might be a supplement plan and a prescription drug plan or a Medicare Advantage plan. We just don't want you at the mercy of original Medicare. But I'm going to focus on those who are on a Medicare Advantage plan and those who are on a supplement plan and you carry a prescription drug plan. So annual election period is the opportunity between October 15th until December 7th to look at your plan and compare it to what's going on in the marketplace. Just like your auto insurance, that 6 month or that 1 year annual renewal, you might see an increase or a decrease, or they might offer a little bit more coverage somewhere. They might offer roadside assistance. It's the same idea with Medicare health plans. Something changes. If it's a prescription drug plan, there might be a change on the copay of a drug, or they might change out one generic for another generic, or they might introduce a new generic if you were on a brand name drug. So there's always a change. Now take note of this. The change doesn't take effect until January 1st of the next year. So that is why utilizing this AEP period between the October 15th to December 7th to look at the other plans gives you enough window, or a large enough window, to start really comparing. So with the plans, you look at your plan that you have right now. You should have received what is called an ANOC, an Annual Notice of Change. This would have come by September 30th, and that would be from your current Medicare Advantage plan or your Part D plan, and it'll have a chart in the first probably 2 to 4 pages, and it's a chart and it's a side-by-side comparison. It'll say 2019, 2020, or whatever year we're in the next year, and it's going to show a comparison of what your plan has this year and what's changing for next year. So it's real easy to look at if you received it. The next step is to find out if these changes are good for you. On January 1st, do you want to change your medication? Or on January 1st, do you want to change that copay? Or maybe they enhanced a benefit, or they took away a benefit and replaced it with something else. You know, a lot of people, if you happen to have a plan in your service area that has a gym membership, they may change who their gym membership provider is. You may not like that gym on the other side of town. I don't know. Those are the things you want to look for. So copays, deductibles, prescription changes. Those are the three most commons. So then you're going to look at your plan and you're going to say, what else is available in my area? Well, we've toggled with the new Medicare.gov website plan finder, and it's helpful. It's a little more clean. It's got a little bit more friendly of color schemes, and it's nice. But we did struggle a little bit with it. And so when you're looking at comparing plans, we always recommend you talk with an agent. Why? Well, because an agent that is diversified in their products have studied all the different carriers, and they know what the hot spots are and what plans have the newest benefits and what's going away because they studied and certified. So when you talk with an agent, they'll be able to do that comparison more easily for you, and then they make a decision a little less complicated, let's say. So I always recommend working with an agent. So let's go back to AEP. Let's say in October, on October 15th, you learned about XYZ plan and you like it. So you submit an application for XYZ plan, and then come November 4th, somebody said, hey, did you hear about this plan that's coming in? I switched over. I know my doctor's going to take it, and they include, ABC. You're like, oh, I just switched plans, but your plan didn't take effect yet, right? you can actually go and apply and enroll in that other plan that your friend just told you about on November 4th. And guess what plan you'll have on January 1st? The new one you just enrolled with. Let's say December 6th, you saw a commercial and something really exciting is going to be included in this plan, or you found out that the prescription your doctor highly recommends that you're going to start taking because maybe a new ailment kicked in. The plan you enrolled in on November 4th is no longer going to be that great plan for you on January 1st. You can make another change. So what I'm saying is, during the annual election period, that window we have to change plans, you could change to multiple plans several times. We don't recommend that, but you can. So if you made a decision early in, you can still make another decision at the last minute. In fact, you can make an enrollment decision up until the last day of December, the last hour of December 7th, as long as it gets to Medicare by midnight, and that's the plan you'll have for 2020. Here's what I'm going to recommend though. Don't make a quick decision. Talk with an agent, do your research, learn what you like about your plan. That way when you're researching, you could say, I want a plan that definitely has this. I don't care much for this other benefit, but this is interesting. I kind of like that. And then you could start making a wise decision, so when AEP is coming to a close, your decision is solid. This is particularly important with Part D plans. During the annual election period, Part D plans make big changes. And with prescriptions, I would recommend this. Go and see your doctor before AEP ends. Go get a really good analysis and have them look at your blood pressure, your bone densities, all those preventative things that Medicare covers, and say, is there any opportunity that I need to look into with the prescription? Meaning, are you looking to recommend something for me? Are you thinking about prescribing me something? Can I get off of some of my medications? What do you foresee in the next, month? And 6 months down the road, let's think long term. So then whenever you go back home and you're researching those plans, you already know what your doctor may or may not need to do for you, so then you can make even a better decision. Because maybe you're in a more expensive drug plan because you're on a particular medication that your doctor was going to wean you off of anyway. So that's something to think about. So it's very important, in particular, that you look at your formularies. So the annual election period for Medicare supplement beneficiaries, they usually don't really pay attention to the mail that's coming in, but that Part D plan is key. What about you folks that are on original Medicare that don't have any health plans at all? That's scary. If you don't qualify for a plan because maybe you're, way older than 65 and you developed an ailment that may rate you if you were to get a supplement plan, I would revisit that, because a lot of the plans are starting to do less underwriting or have easier underwriting. But I don't recommend that you stay on original Medicare by itself. For one, if you are on original Medicare with a supplement and you don't have a prescription drug plan, and maybe you don't take any prescriptions. I had a family member that never took prescriptions. Unfortunately, at the age of 89, when she was mopping a floor, someone set something down behind her and she tripped over a little small ice chest and she broke her femur bone. Well, at 89, if you break your femur bone, you're going to have surgery. And in order for her to have surgery, she had to have anesthesia. So the anesthesia, when she came out, prompted her to have to be on certain prescriptions for the rest of her life. Well, she didn't have a D plan because she was healthy. Now she's on 5 prescriptions and a hefty penalty. So I would always recommend that even though you're not taking a medication, that as soon as you're eligible, go ahead and elect that Part D and avoid that penalty down the road. It's very important. If you are on original Medicare and you only have Part A, and so during the general election period, you elected Part B. Well, we know your Part B became active, let's say, on July 1st. Now you have your Medicare A, you have your Medicare B, but you don't have anything else. Well, if you didn't elect to get a supplement plan, which you have 6 months to do that, and I recommend you do, but if a supplement isn't the way you're going to go because there's a premium to it, then you should look into your Medicare Advantage plans. AEP allows you to do that. And then when you look into the Advantage plans, just remember it takes effect on January 1st. But we never recommend you stay on original Medicare. Why? Well, I have another family member, I have a lot of them. This one, she went into the hospital the day after Christmas. And I'm not going to release any personal identifiable information, but I'll tell you her story. She had the flu, and yes, she had a flu shot. She had pneumonia. Yes, she had a pneumonia shot. And she had a urinary tract infection. All three of those. She went in the hospital, and she was in there from Christmas, the day after Christmas, so she admitted on the 26th, and she was released on January 3rd. That's what, 7 days, 9 days? Her bill, with no surgeries, no physical intervention, just an IV bag, x-ray, and MRI, was $89,000. On original Medicare, she'd have to pay 20% of that. 20% of nearly $90,000. After she retired, she was 88 and a half at that time. So that's a lot of money. But luckily she had a plan in place, and her copay was very minimal, and it was a beautiful experience. So I encourage you that if you're on original Medicare and you had Part A and you got your Part B during the general election period, this is your window to get into it. You have your 6-month Medicare supplement window, but if you didn't utilize it, or you decided you don't want to pay that premium, then I need you to look into your Medicare Advantage plans that are available in your area. So January 1st, you have something to back up your finances, plus your health, which is most important. The other thing about having a Medicare Advantage plan is that because there are so many changes that take place, compare. Now know this. If you have your plan and you read your ANOC and you looked at the benefits and the formulary and it looks good, you're like, I like this. I don't see any reason to change. You don't need to. You just leave your plan as it is, and it will automatically renew. You don't have to reapply. You don't have to speak with an agent. You don't need to do anything. Just leave it as it is, and it will automatically renew. Now, one thing that a lot of people misunderstand is the physician changes. A lot of times a physician will decide to leave a contract, and they say, I'm not going to accept this plan anymore. We don't work with that carrier anymore. That's not uncommon. What that does not do is it does not give you an opportunity to leave the plan. So if your doctor exits the plan, it doesn't open up an opportunity for you to leave the plan. The ANOC does not describe doctor changes, hospital changes, clinic or emergency room, what do we call those when we go real quick, urgent care. The ANOC doesn't talk about any of the provider network. All it talks about is the coverage that it offers and those changes. So if you are going to your physician, as I recommended, go get that last checkup, the end of the year checkup, ask your doctor. They may or may not know, because I always tell you, and I've said this year after year, your worst person to get advice from when it comes to your healthcare coverage is your physician. But at this time of the year, most physicians or their staff will know if they plan on leaving a carrier or if they plan on acquiring another one. And sometimes you'll see signage. So be on the lookout for that. But when it comes for a doctor to recommend your health plan, they don't have time to get involved with insurance nuances. That's what we do. But you do want to ask if they're aware of them leaving a network or so forth, because that may, especially if it's a specialist, if you're seeing a cardiologist or a neurologist, most people don't want to change those doctors. So you want to find out if they are making any carrier changes, because like I said, that's a big misconception. Another thing that you're not going to find in your Medicare health plans is it doesn't cover nursing home or adult daycare in most cases. So if that's something that you are concerned about, and that's what, especially if you're turning 65 and you're new to Medicare and you're just now figuring all this out, that's something that you want to talk with an agent about, because Medicare does not cover nursing care and it doesn't cover cognitive care. It covers the medical side of that, but not the care part of that. So if that is something you're looking for in a health plan, you need to speak with an agent, because then we're going to have to talk about other products that are out there to supplement what Medicare does not cover. And that's the key thing about AEP, is making sure that you're filling all of those gaps. So I hope this helps a little bit. I hope it gives an idea of those that are on original Medicare, those with original Medicare Part D, or original Medicare and a supplement, no D plus D, and those who are on a Medicare Advantage plan. Really, the AEP is for everybody. We ask that you learn, you do your studies, call us, ask questions. We're here to answer them, and that you take the biggest advantage of this time period, because if not, come 2020, unless you have a valid, what we call a special election period, which we can talk about at another time, unless you have a valid special election period, you're going to carry this plan from January 1st until December 31st. So let me mention that real quick. During AEP, remember, even though you change your plan during AEP, the current plan you have will be effective still until December 31st. The new plan election will not begin until January 1st, so just keep that in mind. So if you don't make a change, the plan you have now, you will have until the end of next year, again, December 31st. So welcome to the annual election period. We hope to hear from you. If you have questions, be sure to send them to us. We're here for you guys.